This is Tom Dillon, the Lifetime Liberal, and today is Tuesday, September 15th, 2020. The title of this rant is COVID-19's long-term effects are devastating. So as we head into this election cycle, this pandemic and its effects on us is not going to stop. So we have a thing called long haulers, where they had COVID-19, but it's taking them a long time to recover, 2 or 3 months. When it first came out, it was just like the flu. You get over it in about 2 weeks and everything's fine. And yes, a lot of people, nominal effects, 2 or 3 weeks that it's fine. But the long haulers, 2 to 3 months, sometimes longer, they have a lot of is an excessive amount of fatigue. They have numbness, they have dizziness, they have headaches, lack of sleep, memory loss, and a whole host of other things. So it's not just one thing that everyone gets. It's a whole host of things that get. As I said, plenty of pain, and there has been some recent studies that indicate that this long hauler thing may be tied into our vascular systems, where certain things in our vascular systems are breaking down because of COVID-19, and because that's part of the blood vessels that carry the blood all through the body, that this is where we're seeing where it's affecting other organs in the body besides just the lungs, the heart, the kidney, the brain, what else? And other organs. And as we're looking at this, as we're coming to the election, we've had over 200,000 people that have died. It is estimated that those long haulers could be 2 to 5 times, maybe even a little bit more, the number of people who are those long haulers. And that number is only going to increase, especially as we learn how to find ways to take care of this thing. And the thing about this is, as we're coming into the election, how are we really going to help these people? Because we know that private insurance is trying to get out of all that. We know that this president and this administration is not trying to, let's say, fund the Medicare and Social Security disability. Remember, many people have lost their insurance. They're going to have to get on to, because they're going to have to try to get on to Medicaid. And how will people be able to get back to work? Can they work part-time? Can they work as will bosses keep them in business, allow them to work? So there's a lot of things that are going on here. And this requires tremendous foresight and leadership by somebody, and it's not coming from this administration. Because with insurance, with Medicaid, with Social Security, we have to help these people. It's going to be a long time. It is worth the effort. We can't just let them die away. Now, we had the HEROES Act, which had been passed by the House for 4 months or more. Nothing on that. And the thing is, yes, this is election season. A lot of things are going on. COVID is not stopping. The long-term effects of COVID, we're learning, are much more devastating than we had originally thought. We need to help these people. And, because we have, and until we can get a vaccine or until we can stop the spread, this is going to continue. And again, many of the people who are contracting this, it's not their fault at all, but it is the fault of this administration for basically doing nothing to try and help us get out of this pandemic.